For our promotion project, we focused on the accessibility of the handicapped population on the UMass Dartmouth campus.
The assessment portion of our project revolved around the most prevalent health concern. That was the lack of accessibility on campus for students with disabilities. This included handicapped automatic doors that do not work in many locations. Other locations are hard to navigate due to multiple levels and inconvenient elevator placement, poor snow removal, making it difficult for those who are disabled to navigate campus, and insufficient number of handicap parking spots on campus as well. As a group, we produced 2 nursing diagnoses. The first is risk for injury related to physical barriers as evidenced by broken handicap accessible door buttons, inaccessible bathroom sinks, insufficient amount of handicap parking spaces, and a campus that has more staircases than ramps or elevators. Our second diagnosis was risk for situational low self-esteem related to a decrease in control over the environment as evidenced by poor parking or plowing jobs in the winter, inaccessible lab equipment in the classrooms, crowded dining rooms, and being treated differently or judged by peers.
Another part of our assessment was linking our diagnoses to relevant Healthy People 2030 initiatives, which include improve health and well-being in people with disabilities and promote health, safety, and learning in school settings. We also linked our diagnoses to relevant sustainable development goals. These goals are create neighborhoods and environments that promote health and safety, and increase educational opportunities and help children and adolescents do well in school.
We decided that our target population for this project will be students at UMass Dartmouth with disabilities. We chose this population because it is the largest population at UMass Dartmouth. Therefore, it will be the most affected by the accessibility issues on campus. Some statistics to support this are the student-to-faculty ratio, which is 15:1, and the total students enrolled, which is 7,717. So as you can see, this is the largest populations of students affected. We also acknowledge that faculty will be affected by accessibility issues, but still feel that students will be affected the most because it is the largest population. We interviewed some alumni from UMass Dartmouth as well as some of the staff here on campus. We interviewed a 46-year-old female diagnosed with rheumatoid arthritis, hyperinsulinism, and suffers from overall limited mobility. This alumni graduated last year. We also interviewed a 41-year-old male alumni, C6 incomplete quadriplegic. This alumni graduated around 10 years ago. Lastly, we talked to the fitness center assistant strength and conditioning coordinator, Brandon Williams. These individuals helped to open our eyes on the issues surrounding accessibility. People often overlook how inaccessible this campus is, so it is important these advocates have a chance to be heard.
Planning step 6 involves our short and long-term goals. The first short-term goal is that the UMass Dartmouth campus will have automatic handicap doors installed and working by September 2022. The next short-term goal is that UMass Dartmouth will have established more handicap parking spaces by September 2022, in addition to the spaces already provided on campus. And the long-term goal we have is that the UMass Dartmouth infrastructure will be disability accessible, decrease the amount of stairs, and increase ramps and elevators by September 2030.
Step number 7 is planning. This step is used to help with prevention. For primary prevention, we will educate the individuals on the location of handicap accessibility spots around each building on the campus. This will include parking spots, ramps, and elevators. We also will educate students and families about where to access information for the individuals who need accommodations. This will include the Center for Access and Success building. And for secondary prevention, we will do screening for individuals who need accommodations, provide a virtual tour of each building to show students how to navigate around the campus, and also provide maps that provide directory around the campus. And last but not least, for tertiary prevention, we will create an incident report for individuals to fill out, and we also will create a survey for people to fill out if all their accommodations they had were met. We also will schedule meetings to check in with students and also provide students with extra hands when they need it.
A community-level intervention would be the most appropriate given our target population. The information would be disseminated to the UMass Dartmouth community.
As for information, a virtual tour of the campus aimed at raising awareness towards the accessibility options for disabled students would be conducted.
Some ways that we can disseminate our data and findings include a presentation to staff and students at Scholarship Day on campus, an email to the UMass Dartmouth community containing an easy-to-understand summary of our data and findings, and a posting of a flyer at the UMass Dartmouth Center for Access and Success.
The final step of our assessment was evaluation. It is here that we determine the challenges, the measurement of success, and how we would disseminate the data we found. Some of the challenges that we faced were insufficient finances to implement the necessary changes, as well as resistance to change from the higher-ups on campus. To measure the success, we could gather surveys and more interviews to determine how the accessibility for students and staff has changed from the initial assessment, and as well as how they feel about the changes and if they are sufficient. Lastly, to disseminate the data, we could send an email announcement of our findings to the school and higher-ups, as well as to present at a future campus event, such as another scholarship day or an accepted students day, to convey this data to students and families. Our group hopes that the findings of our assessment will be instrumental in enacting change at UMass Dartmouth and will make the university a more accessible and desirable place to be for students and staff with disabilities. Thank you.